it has shifted the way they think of any treatment option that is offered. And again, I've said this on prior episodes. I'm not anti-surgery. I am pro-movement. The goal of surgery is to improve the general quality of life. That's probably the first acute goal. But it should improve the quality of life past a year. Same thing with any injection that I offer or any modality that I offer. If it helps you only for a week or two, that's not really massively changing someone's quality of life. I quickly pivot to look for other treatment options. And so again, it is something that I wrestle with patients about. In the beginning of my career, I really spent a lot of time saying like, hey, you don't necessarily need a meniscus surgery because we have all these other tools to get you there. And at some point, I started questioning, well, who am I to say that this isn't what needs to happen next? If I present all the facts and the person wants to do surgery, they are doing a calculated risk. I've done my part. Why not? I started really questioning like what makes me the end all be all to say that this is the next best step for them. It's a different type of thinking. It's hard for me to say because for essentially greater than 90% of my clinical practice, I've been involved in the insurance world, the traditional practice. And a lot of times I've seen patients where I thought that surgery is the next best step, but I knew at the back of my mind that if I didn't go through the conservative treatment stuff, even though that is what is recommended, that the surgery was not going to be approved. Sometimes even just to get a basic MRI, you have to do certain conservative treatment options, which again, from a book standpoint is the correct answer. But from a clinician and human standpoint, there are just some times that you have to treat what's in front of you, not read off of a page. And I am glad that I pulled away from the insurance model completely because now I started to see the blinders that I had on, the short-sightedness of some of my initial recommendations as a young clinician. But it is a big reason why I am doing this podcast, is to be the other voice.